very warm welcome to you all. My name's Amanda Jenkins and I shall be doing this presentation today. A warm welcome to anyone that's new to these sessions and welcome back to those that have already viewed. But I have been with Silvalea nearly 25 years, and over that time I've sort of gained a lot of knowledge on slings, and today we're going to look at the issue of toileting. So we know that this is a big problem, but hopefully we can share some of our tips and give you some idea and suggestions for your particular scenarios. So yeah, we're getting more people join us, so very warm welcome. If you would kindly turn your cameras off and mute your microphones, that's really helpful, and to use the chat for any questions. But I'll start by just saying that toileting, people ask for a toilet sling, and you have to think, do they need a toileting type sling or a sling that will allow a hygiene transfer? So we know it all depends on the individual. Got some feedback here. What's the issue with that, Ray? You all right? Okay, sorry. So yes, thinking about suitability for toileting slings, a lot of our divided leg slings will have enough access for hygiene transfer. So just to start this off, I'll just ask Rhiannon to bring up a standard style sling. I think we've got the Universal Deluxe. So anyone that needs more support, they've got to have more full body support, then a divided leg sling such as this one, you will see that there is enough access there for hygiene. So often, this is probably one of the only suitable styles because it's got it offers full body support. Of course, clothing would have to be removed, so it's more time consuming for carers. But in some instances, having a toilet type sling that doesn't have much support, it's probably the only option. So a fuller body sling with a divided leg. So just to give that as a starter. Thanks, Ray. But if we have established that we've got somebody with really good tone, good to reasonable upper body tone, and they can cope with a toilet type sling, then we'll start by looking at the very popular and well-known shape. Judith, my colleague, will help me here.
Good morning.
Good morning to our new viewers. If you would kindly turn off your camera and mute your microphones as we're recording, and use the chat if you need to. Be very grateful. But we're looking at the first one. So this is a really popular, well-known shape. We call it an access sling, dress sling, hygiene sling, lots of different names, but it's this type of style. So when people say, I need a toilet sling, this is generally what they're after. But as I said, it's all about risk assessing for suitability. The Silvalea dress sling like this will have a front click and a wide, thick Velcro waist support there. So this is a waistband here, and it has got the clump click. So there's double security there. The waistband has got this Velcro band here that we know is great as long as it's kept clean and it doesn't get all fluffed up. If it's left open, it can catch the sides and catch on the binding, the fabric, the webbing here. So make sure when it's not in use, it's closed. It's very good as long as it is clean and it doesn't snag on the other parts of the sling. So when it's being laundered, please encourage that to be closed at all times. We do often see, this is all fluffed up and the belt here is all pulling out because it's the Velcro. So, please encourage carers to always close it and when it's being laundered. The other feature for a Silvalea toilet sling, it's got the waistband here. It's stitched right round here, as far as possible to the sides here. So it does give a lot more support. There are some that we've seen that are attached back here. Then, there's a lot more movement, whereas this one is stitched to the very sides. I see we have some new joined Members, please, would you kindly turn your cameras off as we are recording the session, and please use the chat if you have any technical issues. But very well, good morning and welcome. So that's something about the slings. Also, if you haven't joined our other sessions, just to point out that we now have really good labelling. So all the slings have a clear woven label now. These are fully woven, so there's no risk of them fading. It's very important that every time you use a sling that you check that the label with the safety instructions is legible. It's not legible, it contravenes the loader regulations. So always double check. So these ones, as I said, they're woven, so they won't fade. So it's clear information. They'll be the safe working load. On a standard sling, it's 220, which is 35 stone. And that's all the sizes from extra, extra large, small to extra, extra large, goes up to 220, 35 stone. There's a washing instruction. Standard slings wash to 85. Low tumble dry. So often with a sling, we can tell if it's been exposed to high temperatures because the wadding will all bunch up. That bunches up. So we know it's been exposed. Fading can occur if it's a strong biological powder's been used. So we encourage a good quality non-bio without any whitening agents in. Whitening agent acts like a bleach. So if we can, just to check, just so that you can lengthen the life of using the sling, and it's more cost effective than looking after it. But the labels, the sizing labels, again, all woven. There's a unique serial number for traceability. So it's lots of it's really clear. Sizing across the board tends to be the same: small, medium, and large. Small is red, medium is yellow, green is large. So we've got colour coding to denote this is small. So general information. Okay, we do have a microphone on. Someone's got a microphone on, if they wouldn't mind kindly turning it off. So just looking at this then, this one also has a little bit of shaping here. Like scalloping to the top of the leg. That will then give you a bit more access to clothing if we've got to remove undergarments there. So it just gives you a bit more space. I'm going to put it on Judith. Of course, we're making it look really easy and we know it's not. Jude's very compliant, very helpful. We're using a nice open chair, so a lot of cheating. But just to give you, the idea that then hopefully you can transfer it to your situation. This type of thing is relatively easy to put on because we're only going here. So you're not struggling to get it down, which makes it really much easier for carers because they're only going to the belt line. So it is easier. So if you put it on, just put it on, as you would do in a hurry. So we're just putting the waistband. It is a waistband. Don't start it too high at the waist. Front click. And then these leg paddles, which are padded, go around the leg. And the key thing is to ensure you get the leg paddles towards the back of the knee to start with. So towards the back of the knee, if you start them too high, going to immediately ride up and bite into the groin. So start with them, if you can, towards the back of the knee. It will naturally adjust as the hoist takes up the slack. Colour-coded tapes for referencing. We'll go on green. Arms are going to be on the outside. So we just take up the slack before we go too far. Are we all right? Yeah. So I'm just going to take up the slack and we'll see what's going on then.
You want to look at this with me from 10 minutes?
Okay. We can see there's lots of access behind me. So certainly we can get to the belt line really easily. So if we have to remove undergarments, baggy, loose fitting trousers, then it's achievable with this type. But we can see there's not a lot of support. So if Judith was to lose her toe, she's going to do that. You may have seen that. You may have people that think that's still okay, particularly the patient who thinks, no, this is fine. I want to maintain using this sling for dignity and independence, but it's going to have a really bad adverse effect under the arms. It's just not great. So let's just see if we can help and give you some tips to improve that. So if we just start again. As I would say, there's 3 tips. There's 3 little tips that will help. And if you follow them, it really does make a difference. So the first tip is to make sure you fit that waistband at the waist. It is a waist support, not a chest support. So it's got to fit low and firmly at the waist and under the bust of the lady. So it's really important to get that as low as possible to prevent it riding up. So that's the first thing, is get that low and get the waistband, which is got this webbing band here, the webbing strap, pull that as firm as possible. So it then helps to keep that down. So let's just start. So just connect the leg sections together and then we'll put it on again. Again, we'll go on the green shoulder. So fitted it low, we fitted it firmly, and then we'll just take up the slack very slowly. And what you'll find is generally, just explain this. So generally, as someone is seated like this, and the hoist takes up the slack, their body naturally elongates. At that point, that waistband will loosen off. So you need to check. And if it's slackened off a bit, gently pull on the webbing. Again, we're trying to keep that sling from riding up. Pull on the webbing, just at each little stage. Does that feel firm? Yeah. And that will keep it in place. So we've done, those 2 little tips so far, kept it low, kept it firm, and readjusted as the slack from the hoist is taken up. Right, Jude, can you fall through now? Yeah. That's really made a difference just by doing that. It's going to be firm, it's going to be fitted. So if you have a patient that doesn't like that, then unfortunately it may be that we need to look at a different style. But if you still think that they are slightly slumping a bit, think about a smaller size. It's a style that you don't want to be generous with. So it may be that you need to go down a size. So it fits very firm. If the arms there's padding on this style, we do them with and without, but you need to have a couple of finger width under that axilla for comfort, just check. It shouldn't ride up. If it's doing this, then we know that it may be too big. It's ridden up because it's not being fitted low enough. Or possibly that patient has just got such poor tone that it's not suitable. So just those few little tips will help. Let's check. Have we got any questions? We're all good? So this is the most common. If you think that, okay, you've tried all that and it's still not suitable, then we'll look at another style. So we do have within our range, thanks Jude, the continental, low convenience style. So this is like the next stage. It's got a deeper back here and the whole thing has got foam. So it's very supportive, a deep firm back and foam to the legs, which makes inserting really, much easier. It's made in this structured polyester, which has a natural sheen. So it's really quite good to get into a tight or shaped chair. Again, you're only going to the belt line, but this natural sheen helps also to get the legs in. So it's a solid fabric, same safe working load, so 220, 35 stone, and we do all the sizes. But the beauty of this one has this elasticated waist support. So this is detachable. which makes it really useful because you can interchange sizes. Got someone that's got a bit bigger tummy, you might need to have a different size. But it stretches around. And you stretch it and it's really firm. It gives a lovely feeling of security. And because it's elasticated, it doesn't slacken off. So once you've got it in place, then it won't loosen as the hoist takes up the slack. So it's a really useful style. It does have extra bits. I'll show you when I put it on Jude that again you can stretch around for extra support. Being elasticated though means you need to look after it because there's lots of Velcro and stretchy sections. So you need to just be mindful of that Velcro there. But if you just slide it into the channel, yes, if it's not needed, it can be taken out, but it comes as standard with this waist. So we'll just put it on Jude. As I said, because it's firm, you can just slide it into a tighter chair. And again, it's only going to the belt line there. So if Jude fits it as firm as she can tolerate it, so it's really nice around the waist. And then if you need to make it secure, we'll put all those separate sections around. Just gives a real hugging feeling. That's secure enough.
That's very secure. It's very comfortable.
And then the leg sections, again, with the foam in, they'll slide in down the side of, tighter chairs. This particular style is called the low convenience. Very strange name, but it means that you can actually, convenience yourself because we've supplied this successfully to a lot of people that sell hoist. On the yellow. Arms again are on the outside. There is a padded section to denote that the arms are on the outside there. But just check before we go too far, all right?
Yes.
Feel firm?
Very comfortable.
Have a look then, just so we can see the difference. So this is the back section here. So compared to the first style that just had a band there, this is much deeper, but still with access to the belt line. So you can still get there. Under the arms again, make sure you've got a couple of finger width under the axilla for positioning and comfort. But I know Jude won't fall through this. Do you want to try and go through it? Because I know it's a really good fit. And it's been fitted very firm.
It's not in the trunk.
No,
it's very supportive.
A lot of people actually go to this style straight away rather than the toileting sling because they know it's got that extra security of that belt and the padding and the deeper back. So, is a great go-to style if you're considering or looking for this type of sling. Actually, whilst Jude's got it on, there's two in this, they're like sisters. So this is the low convenience, and then the other one is the low back. So this is identical in many ways, but it enables you to have your arms on the inside. So in the event of someone perhaps who can't put their arms over, they've got shoulder issues, they've had a mastectomy, they've got a lot of pain, then this one will work the same, but it just looks like, let's just put it around here. So it fits with, so Jude's arms are on the inside. So exactly the same lower section, but it's slightly higher. So you can't get your arms over anyway. There's no padding, but it works like that. I would say though, so if we have that type of situation, just lower Jude down, that you want your arms in because you have shoulder issues, then it is a good style, but you need to take into account the hoist. Because if this is wrapping round me and I've got a real pain in my shoulders. And this is going on a narrow spreader bar. It's going to pull my shoulders and protract them, adding to the problem. So if you have got significant issues with the shoulders, make sure the spreader bar is as wide as those shoulders or a bit wider. So you're not going to force them, because the sling is going to have to go up to the spreader bar width. So just to be mindful if that is the problem, to check the spreader bar width for comfort. How are we doing, Ray? We're good? So that's the low back, low convenience, low back. They're all on the website. I'll just bring up, actually, Ray, sorry, you've got the toileting sling, or one of the slings. On the website, there's lots of helpful information, which we'll just share with you. This is a page on the standard dress sling. Lots of images, so you can picture how it would look. Lots of helpful data, measurements, a data sheet there, which is really useful to print off for, sizing, so the weights, the codes, things like that. So it's a really useful sheet. Sizing guide. So with sizing for toileting slings, each one's slightly different. But I'll talk about that in a minute, but these will really help. Thanks, Red. So all the information on the website is really, really extensive now. There's a proper library of information per style, and a search button if you're not sure what it is or what the code is. But if you can't find the information, just let us know. We'll direct you to it. Thanks, June. But measuring for toilet slings can be slightly different to normal sling. So we don't need the shoulders, but what we do need is underarm to waist. So the waistband, and to check, because most of them, your arms are on the outside. So underarm to waist and waist, or just above waist here. So each sling, there'll be a diagram of where. Thanks, Jude. So that you can then see if your patient fits into a standard. So there's a little bit of flexibility with sizing, but certainly if they do fit comfortably into the standard, then check. And then we always know that if you need to try something for suitability, we do have trial slings. So please, if you need to try something, get in touch and we'll see what we've got. Once you've worked out your suitable style, then we'll do our best to help you. We do also have some agents and dealers now throughout the country. So to support you guys, if you need a visit, or we can link up like this and help demonstrate, be with you with the patient, help with measuring. So lots of support in that respect. But the last style, I'll be all right for questions. Carrying on. So the last style is the ultimate, really, in this type of scenario for toileting, is our easy access. So it's part of the Continental range that's made in this lovely structured polyester, but with foam, so very supportive around the trunk and the legs. Looks a bit more complicated because you've got an extra tape, but it is easy to fit because, like all these types of slings, you're only going to the belt line, so it's really easy. This one I know has been fitted into really tight situations, tight moulded chairs, because you're only literally going down slightly. So the key thing is to get the trunk section in place. So the trunk section wraps around here. That's going to give support here. So we're looking at a scenario where you've got someone that maybe has lots of movement. They've got variable tone, so they haven't got the support. So we're going to have to do that with the sling. So the first thing is get it in position. And then these tapes here, just undo one to show you. They cross over the opposite side to hug that section there. So get that in position. The legs Also have the foam in to get into tighter chairs. The sheen on that fabric will help. It's very helpful. Oh, hang on, I've got a twist. There we go. And then just cross them. So we've crossed the legs. We've got the thoracic section here. And then the third tape was this counterbalance. The arms go through that. There's a slider here, so and some coloured markers as starting point. So we get the marker on there. You need to extend it, then it's possible. Depends on what we achieve. So 3 tapes. If you start with on the yellow there, the thoracic has got several options as well. We'll go on the longer one. And if we need to tighten it, we will. And then put the counterbalance on last. So on this type of hoist, we've got 2 prong. So we need to allow that to flow if there's any movement. So put the counterbalance strap on top of the others. If you've got a 3 prong, you might be able to put it on the outside, but certainly just so it doesn't get caught. And it will, allow that movement. It's not going to restrict, it's going to allow it, but it will contain, keep that person secure. So let's just take up the slack. It's going to wrap around you. It's going to fit very firmly. You all right? Yeah. Make sure we've got it in. Okay. So the sling is going to do the support. So we're looking at someone with low or poor tone. Let's just see, Jude, can you sit through? No. You bring your knees up. Okay, so it's keeping her contained. Can you extend? So extending this type of situation, you can see. Thank you, Judith. That's very good. That tape is flowing over that. You can see that type of situation. It's ridden up a bit and bringing it up. So yeah. But let's just have a look. The back here, lots of access to the belt line. A deep, deep back here. Good head support if you push your head back. There are bones in there, so they can be taken out, and they would need to be for laundry. They're tucked down there. But it gives this really good thoracic support here. It's not ridden up under her arms. So from the front, this crossband here, I mean, it is firm. So you need to think about, is it going to be too firm? It will force the bust up. So think about that. But for, most challenging situations, this has been very successful. We've got a question.
Quite a few questions, Mandy.
Okay.
How much core strength do you need to have to be able to use these slings versus the standard access sling?
Okay, so the standard access sling, you need the most support, most core strength. And then it's gradually to the lowest scenario. So this one, you need, it's work with poor tone. So because the sling, as long as it's fitted firmly, and it's going to be firm. So if you have someone that's resistant to that firmness, then it won't be suitable. Also, if you've got someone, do you like? Can I just? Yeah. Someone who is quite shapely, because it's fitting very firmly, it may be uncomfortable. So these have been, this one has been very successful with youngsters, athetoid CP, long and lean, lots of action, extension, movement. It's worked very, very well with that type of situation. But I also know that it's been used with adults because it gives that support. But, it's got to be risk assessed for suitability because it is very firm. So it will give a lot more support than a standard one.
Would it go over a peg site?
So the peg, again, it depends where the peg is, but if you've got the waistband in the right place there, the peg can be below or above. Again, it's an individual thing, isn't it, without knowing exactly. But it may be that the peg is free compared to the waistband that goes right around the middle here. So it could be, it has been used with peg feed.
And the last one, would this sling be suitable for an above knee bilateral amputee?
Okay, amputees are, can be quite tricky. So any sling we've seen, if you've got an amputation knee and below, quite often you can get away with the standard ranges. It's when that amputation is quite short, there's no weight, the limb may ride up, that then it slips back. So again, it would depend on the risk assessment, because there's a big aperture there. So, you know, if you've got no weight, that residual limb, it's going to then have the risk of falling back, slipping back through the aperture. So it would be dependent on a risk assessment. Short amputation is probably quite tricky with big apertures. So I would say it would be tricky. Sorry, Ree, was it short or
Well, just
above knee?
Yeah.
Depends where, you know, it would depend where, maybe worth trialing. You know, we'd have to talk about that on an individual situation. Any more? Okay, so they're just a few examples. There are many others, and I know it can be quite confusing because there's so much choice. But it's just to give you a little taster of what we've got. But with any situation, if you're struggling, just contact us and we'll try and help. Certainly, we've got a wealth of knowledge here, a very good team to help with all scenarios. We've dealt with many over the years. So certainly, please don't hesitate to contact us. But I do have a poster we can let you have, though a really good poster that details little thumbnail images of all the range that we show on the website. If you'd like this, we'll certainly get it to you. It's arranged in families of shapes. You've got to select a range, then this is useful if you've got to have a standard shape and a toileting sling. They're all in lines there to show you. There's harnesses, there's accessories. But this is quite a useful tool, which we'll happily send. We just ask for a bit of feedback and then we'll get that out to you. But certainly that's available. The only other thing I was going to say was that if you have, sorry, Ree, can you come back, please? I've just noticed I brought it in. If you have a clip type hoist or stud, wishbone, whatever you call it, with the clips, there is a specific toilet sling for this particular type of hoist. So we call it a wishbone stud, and it's got these clips. So these little clips here, which means a sling with a clip. I'll put it on the outside so you can see that locks on. So if you have this type of configuration, then we have a specific style. So it looks similar. Got your waistband, you've got the lovely big aperture there, but it will always have a head support and very short little legs here that come up just above the knee. So that's the high easy toilet sling. So if you don't deal with this type of hoist, don't worry. But if you're still not sure, have a look on the website. The product page is divided into clip type slings, loop type slings that go on your hook, coat hanger spreader bars. So just be mindful if you've got this type of situation, it's a different shape. Question?
There's quite a lot of people asking about the poster. Could you just explain about the feedback?
The poster. So what we will after the session, we'll just send you a quick feedback form just to give comments, so that we have feedback. These sessions are developed and created from feedback, and you might find that you've had technical issues, it's not been clear, you'd like to see something else. All we ask is a quick little form back, and then we'll follow it with the poster. So our colleagues will then send you out the poster.
And someone just asked what the third sling was, if you can remember.
No. So we started with standard one, the very standard access sling. Then we have the low convenience, arms out, structured polyester. The third one was the low back, arms inside. The fourth one was the easy access, the one that you can have lots of movement within. And then there was this one, which is 5. So hopefully you can find those. They're all on the website. So all of them actually would be in the standard section on the loops. And this would be in the standard section of the clips. But we've got a new prospectus just about to go out. We've got lots of new sessions. We're introducing new products. So please have a look. If you don't get one directly, it'll be on the website soon. For the rest of the year, there's generally 1-2 a month on different subjects. If you have any specific requests, then let us know. If you have a group that you think this might, benefit from a session, a bespoke session, I'm very happy to do that. Just need to email customer services, and then I'll start the conversation with you. But very happy to do teams, a little team with your team, if needed, and then we can tailor it. Use the poster to pick your slings, and then we can create a session for you. But is there anything else, Ree? Okay, well, thank you very much for your time. Hope it's been helpful. And I look forward to welcoming you back at other sessions. So thank you very much, everybody. Thanks, Judith, and thanks to Ree. Thank you.